Hi, my name's Tess Walls, skin therapist, helping people celebrate the skin they're in for more than 3 decades. So what we're going to talk about today is you may be in your 20s and you've just started to see lines appear on the skin. Now, before we can talk about what we can do with that, let's talk about what's happening. So basically beneath the skin starts to deteriorate before we see or experience symptoms on the surface. What we need to work on is improving the overall health of the skin and minimizing that deterioration that's going on underneath. So what are the types of things that start to happen? Melanocyte activity increases, which means that our darker melanin starts to produce color, and that's where we start to see uneven skin on the surface. So we need to actually minimize the melanin from producing that darker pigment. We need to also work on improving the water level of the skin using things like hyaluronic acid, and we need to add vitamins into the skin or oxygen to increase the overall cell health and respiration. Basically what we're trying to do is wake the skin up and give the skin back its energy. For clients in their 20s, what I like to start them on are things like oxygen ranges or vitamin C ranges, as we're really dealing with those first signs of aging and how we can actually help minimize the symptoms from coming to the surface. So we're prolonging aging, if you like. So one of my best ranges that I like to use for this is the Excel Therapy O2 range in Germaine de Cappuccini. So we have a few steps in this, which I'm going to take you through. And the first of which is your cleanser. So cleansing, a lot of people think, is it really necessary? Is it something that's important? Can't I just use a cheaper cleanser? Well, the answer is generally not. Cleanser might seem like you're just putting it on and washing it off, but this is a really important step to actually keep our protective film intact. So we naturally have a hydrolipidic film that sits on the surface of the skin. Hydro meaning water, lipidic meaning oil. I want you to think of this as like a layer of cling film that's sitting over the top of a glass of water. If we don't have that intact cling film, what happens is the water will be evaporating out of the cup. So this is where we start to see dehydration in the skin. So this step is really important. A lot of cleansers are too harsh, they're full of acids, they might have exfoliating particles or scrubs in them, or they're foaming and it's just not suitable for your skin type. So I always recommend getting onto something like the O2 cleansing milk if you're a more normal to dry skin. Size of a 5-cent piece is all you need. Little circular motions all over the skin. This cleanser is also perfect for anybody of any age. So we even use this as part of our anti-aging program. But it's great to introduce when you're in your 20s because prevention is better than cure. Our other option for cleanser we have in that range is we have the 365 soft scrub. Now, although it sounds like an exfoliant, it is a cleansing foam. My little tip here is to give it a really good shake. A bottle of this just lasts forever and it always goes onto wet skin. So this is perfect for the clients that like a cleansing foam but want to actually feel like they're getting a little bit of a daily scrub as well. So give it a really good shake, size of a pea in the hands, and then just foam it up with a little bit of water and little circular motions all over the skin, and then remove your cleanser with a really wet face cloth. This will actually give you a thorough cleanse, remove any impurities, but keep that protective film intact. The next thing we need to do is we need to use a lotion. So O2 lotion, size of a 5-cent piece in your hand. This is what we call our hydration prep. So this lifts the water level up in the skin, floods the skin with water, and keeps your skin nice and healthy. It also saves you money in your serum or your cream. So it's one of the best things you can add into your skincare routine. My next true essential would be hyaluronic acid. Hyaluronic in any form is fantastic for the skin, but this is a special one, and I do have an additional video on this that talks about those 3 molecular weights and how important it is for your skin. You then choose your moisturizer, and in the O2 range, specifically designed for clients in their 20s, you have a cream for more drier, normal to dry skin, or an emulsion, which is more for combination or oily. You also have an eye cream, so it's great for those first signs of aging. And then my last personal favorite is the CC cream. This is one of our most popular products. It is a great one because it acts like a foundation, gives you great skin coverage, but it also has anti-inflammatory and anti-pigment extracts. It's got a SPF 30, but it gives a really nice even skin tone and actually suits over 6 different skin colors. So it will change when it goes onto the skin. It picks up the warmth in the skin and basically adapts to your color. So moisturizer goes on size of a pea of your CC cream, blend it into your fingers until it's a bit warmer, and then literally pat it into the skin and blend it. It's a great one, and you will be so surprised what a difference it will make to your skin color. Well, hopefully this has helped today for you to understand if you are seeing those first signs of wrinkles, what's going on underneath the skin, and that prevention is better than cure. So get onto a skincare routine that's going to give your skin energy, improve skin color with oxygens and vitamins, and just overall improve your skin health. Thanks so much for watching. Don't hesitate to reach out to the team if you have any questions, or check out the website if you want more information. Take care. Bye-bye.